A patient comes to ED following a bee sting and has diffuse rash, hypotension, and throat tightness. One injection of IM epinephrine dose doesn't improve the client's condition. What should be the actions that nurse take in the correct order? All the choices must be used. Number 1. Administer IV fluid bolus. Number 2. Administer methylprednisolone. Number 3. Prepare for emergency cricothyrotomy. Number 4. Administer epinephrine IM and repeating epinephrine every 5 to 15 minutes. Number 5. Ensure patent airway and administer oxygen. Number 6. Place the client in a recumbent position with both legs elevated. Number 6. Place the client in a recumbent position with both legs elevated. Number 7. Administer antihistamine. Number 8. Administer bronchodilator. Number 9. Remove insect stinger if present. The correct answers of this question are 5, 9, 4, 6, 1, 8, 7, 2, 3. Ensure the patent airway and administer oxygen. Number 5. Remove insect stinger if present. Number 9. Administer epinephrine IM and repeating epinephrine every 5 to 15 minutes. Number 4. Place the client in a recumbent position with both legs elevated. Number 6. Administer IV fluid bolus. Number 1. To expand volume and maintain BP. Administer bronchodilator. Number 8. Dilates small airway. Administer antihistamine. Number 7. Fixing the hypersensitivity and relieve those pruritus. Administer methylprednisolone. Number 2. Decreases airway inflammation and swelling which associate with the allergic reaction. And the last one, prepare for emergency cricothyrotomy. Number 3.